Hello friends, welcome to Expert Medical Coding. In today's video, we are going to learn about the disorder of esophagus, GERD. We are going to see what is GERD, what are the symptoms of it, and what are the causes of it, and what are the tests available, and what are the treatment options available for GERD and precautions. And we'll also see the coding part of GERD. So let's get started. What is GERD? GERD, that is gastroesophageal reflux disease, occurs when the stomach acid flows back into your esophagus from your stomach. This acid irritates the lining of your esophagus, causing a burning sensation in your chest. Now let us see the symptoms of GERD. Burning sensation in the chest, upper abdominal or chest pain, trouble swallowing, hoarseness in the morning, and dry cough. Now let us see what are the causes of gastroesophageal reflux disease. It happens when the wall that prevents the stomach contents from going back up to the esophagus becomes weak or opens when it should not be opened. What are the tests available for GERD? Upper endoscopy, ambulatory acid pH probe test, X-ray of the upper digestive system, esophageal manometry, transnasal esophagoscopy. Non-surgical treatment options are antacids will be given to neutralize the stomach acid, and medications will be given to reduce the acid production. They are H2 blockers, and medications will be given that block acid production and heal the esophagus, proton pump inhibitors. Now let us see the surgical options. They are fundoplication, Linex device, transoral incisionless fundoplication. Let us see the precautions. Patient need to maintain a healthy diet, stop smoking, elevate the head of your bed, don't lie down after a meal. Eat food slowly and chew thoroughly. Avoid foods and drinks that trigger the reflux. Now let us see the coding part of GERD. The first step to code the GERD, that is GERD, is search the term GERD in the ICD. You'll get a code of K21.9 in the IC10-CM index. Now the next step is to go to the tabular list to cross-verify that particular code. In the tabular list, we are finding the K21.9 code. The description of it is gastroesophageal reflux disease. So it is not further expanded. So we can take this code as GERD. Please like, share and subscribe to Expert Medical Coding. Thanks for watching.